Mornings can be hectic. We get it. You're pressed for time, but you still want to stay informed. Let the connector from Boise State Public Radio do the work for you. Every weekday morning, this quick and convenient podcast delivers the top Idaho news stories you need to know, all in the time it takes to brew your coffee or start your commute. No scrolling, no searching, just hit play and get connected. Listen to the Connector Idaho Daily News wherever you get your podcasts.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. The flu is on the rise here in Idaho. There has been a huge surge of norovirus cases in the U.S., and 2 bird flu cases in humans are causing concern among doctors and calls for action from government officials. Well, it's Wednesday, which means Dr. David Pate is joining us. He is the former CEO of St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question for Dr. Pate, send us an email at idahomatters@boisestate.edu. So, Dr. Pate, let's talk about the flu because it's even being talked on national news programs right now. So it's on the rise here in Idaho. And in fact, we recently learned that 8 people have died here in Idaho already this season. So is this looking like a typical season or not?
Well, that's my big question. I saw the report that we just had our 8th death. And given that we had a little bit of a late start to our flu season this year, I was surprised that we've already got 8 deaths. And they tend to lag in the reporting. So I'm certainly concerned. But I'm also concerned because we are certainly getting reports out of some European and Asian countries that they are having situations where their hospitals are getting overwhelmed in large part, but not solely due to influenza. So I'm watching. I don't know how bad this is going to be. Australia that we usually look to because they have their flu season right before ours. They reported it was one of their worst seasons on record. So I suspect this is going to be a bad flu season for us. I don't know how bad, but certainly I was impressed when Primary Health announced that their test positivity rate was over 50%. That's huge. And because you'll remember, listeners that we've talked to about with COVID testing positive, we didn't like it to be above 5%. They're reporting over 50 for flu. And I certainly recommend, if you haven't gotten your flu shot yet, get it now and don't delay because it takes a couple weeks for that to fully kick in for the protection you're going to get from severe disease.
So let's talk a little bit more about that, Dr. Pate, because area doctors really are sounding the alarm about influenza right now, and they are really urging folks to get vaccinated. So as you said, it takes a couple of weeks for it to have that efficacy that you want, but people, I would think, haven't necessarily missed the window yet.
That's right. And so, and certainly what we know from history is school-age children propagate the influenza outbreaks, and they bring it home to their parents and other family members. And with school just having gotten back in session after the holidays, I think we can expect a further increase in number of cases. People tend to underestimate how miserable the flu is, even if you do perfectly well with it. But it is certainly very dangerous to people, and not just the elderly or the very young. It can certainly cause problems for people of all ages, including a slightly increased risk for some bacterial infections after the flu. And more and more over the past decades, we've realized that your risk for stroke and heart attacks does increase after influenza, at least for a while. So it's not something that's fun to have. You're going to miss a lot of work. I would certainly encourage people to get flu shots, but it's time to not be out around other people if you are sick, and we got to just help protect other people for right now.
So, Dr. Pate, we talked about this a little bit before the holiday break, and that was getting the flu. As you mentioned, I think a lot of folks have this idea that, oh, it's just like a cold. Let me tell you, I got the flu once in my 20s, and I didn't get the flu shot. All it took was me getting the flu one time and realizing that I don't ever want to feel that way again. And so, if even if I got the flu, I'd rather be vaccinated against it to at least keep it at bay. With that said, though, when I had the flu, I was able to get Tamiflu, and I know there's a window for that. Is should folks still be looking into that if they are diagnosed with the flu, or if someone in their family is? Is that still an option?
It is. So that is a antiviral, meaning that what it will do is once infected, and like you said, if taken soon thereafter, and typically
Hmm.
we're trying to start it within 48 hours of the very onset. The nice thing about it's not a nice thing, but the convenient thing about the flu for us doctors is and patients is it usually patients know, oh man, I got my symptoms at 2 o'clock today. They could
Uh
tell
huh.
you because it's not subtle. It hits you like a ton of bricks. And so people are usually pretty clear about when their symptoms started. And so we like to start the antivirals within 48 hours. So talk to your doctor if you're someone, a candidate for that antiviral. Typically, people that we expect are going to have a rougher go of things if they're immunocompromised, if they're older, and so talk to your doctor if you get it. But yes, time is of the essence, or else it doesn't appear that you get very much benefit if you wait much longer than that.
Yeah, the flu's miserable. Plain, it's miserable.
Terrible.
So,
And besides that, typically what makes it different, because a lot of people call colds flu, but what's very different is number one, the really rapid onset of symptoms. Number two is typically you're going to have higher fever than with your typical cold. And the third thing is it is quite common for people with influenza to hurt over every part of their body, and they don't want to be touched. And in fact, in some patients, even just moving their eyes causes them discomfort. So it's typically dramatic. It's worth getting tested for and consideration of antivirals if you are at high risk.
and before we move on from this topic, Dr. Pate, what about if you have like an infant? Because I cannot remember when they can get vaccinated. I know I did get my kids the flu shot, and I think they did the nasal spray when they were really little, but as soon as they could. But there's a window of time where like babies can't get vaccinated for the flu.
Well, that's right. And so for the first 6 months of life, that baby is really dependent on two things. One, for the pregnant moms getting their flu shot if their pregnancy is entering the flu season, so getting the flu shot so that they pass some of those antibodies to the baby. But the second thing is just protecting the baby. I cringe when I see little babies in arms of people out in big crowds right now. This is probably a good time to protect those little infants because they can't get vaccinated before 6 months.
Yeah, I have to say, I had a baby born in November and he got RSV. He seemed to be sick all the time. Now, granted, I had a 3-year-old at the time who brought every germ home. So it is distressing when you have a baby that cannot get these vaccines and you are doing your best to keep them
Yes.
healthy. Yeah, it can be scary. Okay, with that said, Dr. Pate, norovirus cases are surging in the United States. Remind us what this is and what is going on, because here we've got the flu season and now we've got norovirus.
Yeah, well, norovirus is also one that we expect to increase every year, typically between about November and April. It is often called the winter vomiting disease, to give it a
Oh,
pretty name and an apt
oh,
description. It's also, a lot of people refer to it as stomach flu. both are misnomers because, first of all, we can see norovirus other than just in the winter. Certainly, we see many cases still into the spring and even occasionally during the summer. But so it doesn't have to be winter, but this is the time we expect big peaks in it. And then the other thing is the other misnomer is referring to it as flu because this virus is completely different than influenza viruses. So the norovirus can be transmitted by touch, by even touching surfaces that are contaminated, or by somebody who has norovirus, then preparing food without carefully washing hands, and then that can be transmitted. So typically it's transmitted in close contact. We have to be very careful when this occurs on cruise ships because it usually causes a big outbreak, and we're certainly seeing those, but also schools, also in homes. This is the case, unlike COVID, where you really do need to be cleaning surfaces and keeping things clean. The other thing is about norovirus is that it is not effectively killed by hand sanitizer. So for this one, when you've got somebody who is either puking or pooping their guts out in your household, you need to be washing with soap and water very well and very digitally, because this is highly contagious. The good news for most people is if you get it, you typically are going to get better very quickly. There's no specific treatment, but typically, even the next day, you're going to be feeling better. You're going to have a miserable 24 hours, but usually it doesn't hang on and hang on. If your symptoms are hanging on, there might be something else going on. Be sure to get in touch with your doctor.
Okay. And then Dr. Pate, a really concerning story coming out of Louisiana. Can you talk to us about this? Because my understanding is that in Louisiana, they are telling health workers that they cannot promote vaccines. So we're talking things like COVID, the flu, Mpox.
Yeah, this is very disheartening. It was not shocking to me because we are seeing this happen. Obviously, we've seen some people that are anti-vaccine, anti-science, getting into areas of decision making in Idaho in public health. The Surgeon General in Florida has been rebuked, maybe is the right word, at least twice that I know of, by the CDC director and FDA director for putting out false information. Now, Louisiana, after having just experienced the first human bird flu death in the United States, has now two health leaders that are both spreading at least misinformation if they believe what it is, or at worst disinformation if they know it's wrong. But this is not looking good, and they did not make a written policy, but they communicated to staff that they could not advertise, put anything on the website, do any kind of outreach about those three vaccines that you mentioned. Why they picked those three, I have no idea. But I do think we're going to see more of this. This is just beginning. And what's so important for your listeners is that continuing, depending on how much this spreads to other states, you really are going to have to, if you want to protect yourself, you're going to have to learn how to find out information for yourself and verify sources, because they are just putting out demonstrably false information if you research it. And I think same thing for some of the information that came out of our Southwest District Health. I listened to the physician explain his rationale. I could probably in 20 minutes show evidence to refute half of what he said. It's just not correct. It's demonstrably false. And we're going to see a lot more of this.
So, Dr. Payton, somewhere like Louisiana, where there have been health workers being told you can't promote these certain vaccines, I'm thinking about just here locally, right? Like you walk into a grocery store with a pharmacy right now, and they're saying it's flu season time, right? Get your flu shot. But they even have things like shingles. Like I mean, the list goes on and on when you walk by a pharmacy. So I would assume then in a place like Louisiana, pharmacies wouldn't even be able to put a sign out saying you can get your flu shot here.
Well, they can, and there would
Okay.
certainly be some legal challenges. Of course, I've become less certain of my ability to predict how courts are going to rule on things lately, but there would be some legal problems with that. But what this was merely these leaders communicating to the public health, the state government influenced operated public health agencies that they could not promote these vaccines. I think this is just the start, though. To your point, there's going to be more, and they're going to find more and more ways, which is really a tragedy. I have talked to many people that are very skeptical of vaccines or are kind of fighting back about what's happened over the pandemic. And I understand their reasons. I've talked to many of them. I think that people are upset about they got wrong information from Dr. Fauci about masks, and I think he's admitted it and realized that was an error. They are very upset about quote unquote lockdowns or mandates. What I would prefer to see is let's have leaders, and those are political decisions. Let's have leaders discuss those things. And if you don't want mandates and lockdowns and those kind of things, then pass laws to prevent that. But unfortunately, what has happened is things, like the old saying that for every action, there's a reaction. Well, this is just going far too much to the other extreme because of their anger about those things to actually just decrease confidence and also make it harder and harder for people that do want to get these things to get them. I think that's the wrong move, and it's going to prove out to be a very bad move on their parts. But we have to face the reality and be prepared.
Dr. Payne, I want to talk more about where we are with bird flu. In fact, you were able to get more information on the teenager in British Columbia who was infected with bird flu. Now, you even saw her x-rays. So tell us about the case and also why it has you worried.
Yeah. So, we talked about before on this show that sometimes it's a little hard for me to give your listeners advice because we're not getting enough information from the public health agencies to get the kind of details that I would want to know in order to advise other people. Well, we now have lots of details about this case, and it's just fortunately, there's a happy ending. She survived. I don't know if she has any long-term problems. Wouldn't be surprised if she does. But this was a 13-year-old. So we knew it was a teenager, but this is as low as you can be and still be a teenager. It was also a girl who typically through COVID, we've always thought about boys or men getting worse cases, but this was a 13-year-old girl who was generally in good health, but overweight and had asthma. And the best information is that she probably was exposed to birds. We do know that this was a bird source of bird flu rather than the cow source that we've been hearing about infections. And it appears that the avian flu that has been changed in the cows and is spreading in our cattle, when it infects humans, it's not causing severe disease. But the virus from birds is what we're really worried about because that's both the source for this girl and the patient in Louisiana who died. And what we did know that she had breathing problems and was in the ICU. But what I found out, to your point, was I got to see her x-rays and some of the laboratory tests. She went from in one day when she was first admitted to the hospital, having a pneumonia localized to one lobe, which generally is not severe, especially not in a 13-year-old with underlying good lungs. But by the next day, this pneumonia had spread throughout her lungs in a
Oh
very
my gosh.
dramatic fashion. And concerningly, to keep this girl alive, because her oxygen requirements went up so much, not only did they have to put her on a ventilator, which many of us and the listeners will understand is a mechanical breathing machine. They had to go to the highest extremes that we can go to, which is putting people on something called ECMO, which is really like
Oh
a
my
heart-lung
goodness.
bypass machine. This is the machine that we only can use in advanced critical care units with advanced training. We don't have that many of them. There are countries that don't have any of them, but she required this, as well as something we call continuous renal replacement therapy, which is kind of like dialysis in a way, and the plasma transfusions. So the point of this being that at least in this one case, and a relatively healthy person, she required the most resources that we have available in any of our American hospitals. The point being, should this become something that ends up becoming a epidemic or pandemic in terms of human spread, um, we will get overwhelmed quickly if people are going to get this severely ill. And all of our previous reports from bird flus of previous kinds has been that they're associated with very high mortality rates. Now, the gentleman in Louisiana, was an older man, and he did have underlying medical conditions, and I've certainly seen people responding to that. Oh, well, see, it kind of like they did with COVID. Oh, it's gonna impact older. I don't have time to explain today on the show, but we could certainly talk to it. But I believe that actually the elderly are not going to be the highest risk from bird flu for some various reasons. I think it's going to be, and certainly we have seen this play out in other cases where bird flu has in previous years infected humans. It tends to make younger people extremely ill, and that's where we see a disproportionate number of deaths. So very, very, very concerning. But thank God, and hats off to the Canadian healthcare teams that were able to save this girl's life.
So, with that said, Dr. Pate, what should we be doing right now? I mean, I'm sitting here, I have a 13-year-old, and I mean, he's not around birds, but I mean, we do know that this is contagious, and we have had, outbreaks in dairy cattle in Idaho.
Right. And we have recently identified bird flu in birds, wild birds, and migratory birds here in the Treasure Valley. So it is here. So for right now, do not try to pick up or dispose if it appears to be a sick bird or a dead bird. Don't pick it up. If you're going to dispose of it, put on a N95 mask, put on gloves. Make sure that you use a trash bag to get the bird, but using the trash bag to pick up the bird, not your hands. Make sure that after you have disposed of that bird, that you wash your hands very carefully. Watch for your animals. We do know cats are especially vulnerable to this infection. It appears we're getting more studies on dogs. It appears that dogs can, but if you have animals that are outside, be very careful, especially with cats who might come across some of these sick or dead birds. If you're going to let animals out in your backyard, I'd scan your backyard first to make sure there isn't a dead bird out there. And so take those precautions. Right now, it's the risk is not particularly high, but we need to be doing a lot of things as a country. We need to be developing rapid tests. One of the things that we're very concerned about right now is we're having our regular flu season. You and I started the show by talking about how much a human flu we have. It would be difficult to tell the two apart. And so we need better testing so that we know if we're starting to see the bird flu in humans. And frankly, our federal government is not responding at the rate they need to with this. We also need to, you and I talked about Tamiflu early. This virus looks like it could develop resistance to Tamiflu with a pretty minor mutation or set of mutations. We need to be developing more antivirals. We do have some that we can use as backup, but we need to be developing more. And we're not sure that the vaccines that we have in the stockpiles are going to work. So there's a lot of work for our government to do. We need our government to get on this. Even if this doesn't pan out and turn into be a pandemic, we will learn and be better prepared for the next one if we take these steps now.
Okay, Dr. Pate, I only have like a minute left, but we should note that a former FDA director is sounding the alarm about the bird flu, and they want the incoming Trump administration to take this seriously. So thoughts on that really quick. I know, and we can go back to this the next time you're on the show, but I do want folks to know that there are folks asking the incoming administration to do something.
Yes, and that's Dr. Gottlieb, former FDA commissioner in the Trump administration. So that is good. You can read his op-ed. I think it was in the Washington Post. It's very good. I agree with everything. There are others too. I'm also talking to some other people that have been in the Trump administration, encouraging a vigorous response.
All right. With that said, Dr. Pate, so appreciate this. And of course, if you have questions for Dr. Pate, send them into us at idahomatters@boisestate.edu, and we will do our best to get those answered. We've been talking with Dr. David Pate. He is the former CEO of St. Luke's Health System, and he's also the co-author of the book, Preparing for the Next Global Outbreak. Thanks, Dr. Pate.
My pleasure.
You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudet.
If you like podcasts like this, explore more from the Boise State Public Radio podcast family. There you'll find a mix of daily news, Idaho Voices, and in-depth series on a wide range of topics. I'm talking wild horses, political scandals, sustainable ranching, and militia groups in a post-January 6th world. Wherever you get your podcasts, just search Boise State Public Radio to find what Idaho's NPR station has in store for you.